first person I'm going to call is a lady who is a classmate, a colleague, one who I've known for a long time, but Quentin has known a lot longer. She was his friend, his partner in private practice, and colleagues on the boards of health, medicine, and physicians for a national program. She is none other than Dr. Claudia Fegan.
Wow. Quentin knew me before I was born. And there are a lot of people in this room who have a lot of stories that they could tell about Quentin. So I really take it as a privilege that I get to come up, but it's because I cross so many genres, if you will, with Quentin. All right. So, as I said, when I first came to practice, I practiced with Quentin. Quentin knew my parents before I was born, but when I came to practice with Quentin, there was a wall of awards. And Quentin used to say that these awards were proof of longevity, that if you hung around long enough, you got awards. But he was wrong about that. This was all about social justice. And Quentin has been a stalwart for social justice in this country. Whether it was marching with Dr. King or being his physician, whether it was protesting the fact that hospitals in Chicago wouldn't allow black physicians on their medical staff, whether it was talking about single payer, Quentin has always been about what is right and what is wrong. And when other people found it convenient to close their eyes, look the other way, or pretend that the status quo was okay, Quentin was always there saying what was right. So I talk about we're here as a part, and I want to remind you that we're here to celebrate Quentin's birthday, but we're also here because one of Quentin's pet projects is the founding and the working with Health and Medicine Policy Research Group. We've been around for more than 25 years now. And every 5 years, we celebrate Quentin's birthday. And we do that because, Quentin says if you're going to change the world, you have to be involved in politics. And if you're involved in politics, you have to raise money. And the way the current economy is going, we're going to have Quentin go on to 125 so we can keep making this. And so I hope I'm glad everybody's here. I hope you eat well. Hope you bid on items because the cause, the struggle needs those dollars. That's the grist that makes the mill go. But I'll give you, I remember some years ago when I was still in practice with Quentin, and that's another classic example. I practiced with Quentin. I enjoyed being in practice with him. It was probably the most fun I ever had in my medical career. And when I decided to leave there to work at County, Quentin refused to ask me to stay. Although Ruth told me that he really didn't want me to go. He said, I can't ask you not to go because it's good work. I wish you wouldn't, but I can't ask you not to do that. The example I wanted to tell you was Quentin was downtown because he wears many hats. He was downtown and he and Margie had met with a donor, an anonymous donor, who had agreed to give a lot of money to health and medicine. And he was gleeful with joy that he was going to get this money for health and medicine. And yet he was late for the office. And so he was running through the underground parking garage and Quentin's shoes, I don't know if you've ever seen the bottom of his shoes. Kind of slippery, so he took a nasty fall, but no time for that. He picked himself up, got in the car, and came to the office, went straight into the exam room with his first patient who'd been waiting to be seen. And by the time he was there was a huge egg on his head of, okay, there are enough physicians in the room, hematoma. And it impinged upon his vision, and so there's this lump that's swelling down and he can't see. So he walks up to Dave Wechter, one of our partners, and it's a line from Rocky. He says, "Cut me." And Dave says, "What have you done?" Well, what he had done was fractured his collarbone and broken his ankle and had a big bruise. But never mind that, we got this check. Practice with Quentin was always an adventure. And one of my favorite, we moved into our new office some years ago, and there was a patient who came up to the front desk to complain. Terry, I'm trying, I'm going quick. The patient came up to complain and said, you know, I've been waiting for Dr. Young. For 2 hours I've been waiting for Dr. Young. Patients come, patients go, patients come, patients go, and I've been waiting here all this time, and no one's seeing me. And the clerk, who was very adept, said, and how long have you known your little doctor? 34 years. 34 years I've been coming to see Dr. Young. And the clerk said, and what's changed in that time? And the woman politely went back and sat down in her chair and didn't say another word. You know, I've given 3 minutes, and as Quentin would say, I can't clear my throat in that time. But the other story I wanted to tell you was that in Quentin's record for PNHP was in one day, he gave 5 presentations of this PNHP slideshow, Physicians for a National Health Program slideshow. 5 presentations. He started with nursing students, he talked to medical students, he talked to physicians. At the end of the day, he finished with nurse associates. Ida Hellender, who was our president and executive director of PNHP, gave up. She sat on the outside. She couldn't listen to it anymore. But Quentin gave these 5 presentations. And if there's anyone in this room more committed to universal health care, they have not walked yet. So, as a birthday present for Quentin, I'm going to ask, because I know Terry tells me I've gone over time, I'm going to ask just once if I could get a really loud refrain of everybody in and nobody out. I think it would be a suiting birthday present for his 85th birthday once. Everybody in, nobody out. Thank you.
Thank you, Dr. Fegan, and thank you for getting everybody's adrenaline revved up. The story about Quentin having a big egg on his head reminded me of a story someone told me when Martin Luther King was here marching in Gage Park. He was hit by a rock in his head, and Quentin was his doctor. I didn't know what he did for it, but he told me that what he did was sort of looked at it and said, oh, it's swelling, and that was about it. But they kept on marching, isn't that right? They kept on marching, and Quentin said that he'd always liked to be able to take care of Dr. King, but there wasn't a lot of things wrong with him. So sometimes he'd have to try and say, well, I need to examine you more thoroughly, so he could spend more time talking with Dr. King.